One of the things I knew about Madison was that she had been coming in for so many times, 3-week cycles. And so I was starting my peds hemonc rotation, and everyone in the workroom was just exuberant. They said, "Oh, Madison's coming, Madison's coming." And I'm like, "Who's Madison?" And I was definitely about to find out who Madison was. She came in that Monday afternoon, and she wasn't in her room. She wasn't, moping around. She was sitting at the nurse's station just laughing and talking with everyone. And the whole atmosphere had just changed. Like, it was just this bright spot. You were such a joy to everyone around you. And we got you checked in. We got all your vitals checked. And then one of the residents was like, "Hey, you want to go grab coffee?" And here you were with your IV pole. We took it down on the elevator. Just that week, it was amazing to see how much you impacted not only me, but the community around you. It was something that everyone talked about you, how amazing you were. And so to see that, even whenever you were fighting what you were fighting, you still stayed very positive.
When I told her I couldn't have real flowers, she brought like crafts with the flowers and stuff. I still have that, by the way. We were working on a craft project one afternoon. The child life specialist, she came in and she said, "Hey, Madison, do you have my book for me?" And I was, completely oblivious. I'd never heard of it before. And she proceeds to pull out this book, and she told me it was for her beads and her bead collection. And so whenever I asked her, "Okay, what does this mean? What is this about?" She told me that at the child life specialist here at the Maynard Children's Hospital, they give every kid that's fighting cancer a keychain that they start with their name at the top of it. And every single time you have some sort of event happen, you get to add a bead to that chain. And so some beads represented, really good events, like the special beads that you had, like whenever you got your first wig, or oh yeah,
or when I think you met another friend fighting cancer, you had these beautiful beads interspaced between some dark ones. I remember you had a string of 4 black beads.
Yeah.
And we were talking about what those beads meant, and you said, "Oh, different ones you can stick for like a needle stick."
Most common one that I have on mine particularly are yellows, which are overnight stays. Purple is IV infusions. Red is blood. Black is pokes, like IV pokes, port pokes, just anything with a needle. I have a bunch of light blue, which is eye care treatment or mouth care treatment. Chemotherapies were white. Therapy in general, like whether physical, occupational, all that were rainbows. Like when we first started it was just, okay, here's like a couple of beads or whatever. But then after a few weeks, after a couple months, it's just like I was saying, I remember, like, I look back at those 4 black beads at my beginning, I was just like, wow, like, and it just makes me kind of find a sense of pride that, like, I did this, I'm doing this, and I'm gonna make it out in the other end.
But those 4 black beads represented, I think, what was it?
It was one of the first times my port, it's like basically that IV that's like down, like right under your skin right here, where they miss a few times, and it was 4 pokes total that they did like back to back, and it was basically my first traumatic experience in the hospital. But that's what I love about the beads is that especially now, it's like I can look back and find those 4 beads, and like I remember that day I thought it was over. Like I was just like, I'm in so much pain, and it's so far back, like it's so far at the beginning of this 40-foot long string that I'm just like, I thought it was done right there, and here's the whole, like, I just love my beads.
Sometimes we have these debriefing just classes where we talk about patient experiences or things that impacted us in a positive or negative way. It was so funny because someone would mention, "Oh, I have this 17-year-old patient in the peds hemonc unit," and we all turn around and look and say, "Wait, I think we're all talking about the same person."
Because like you said, y'all have tests, lectures, all notes, everything, so much to learn and do. And it's like you took time out of your day to come visit me, and it just, I don't know, it made me feel special and cared for, and it proves to me that, like, you're gonna be a great physician in the future. because it's not just about textbooks and money or whatever else. You really care for your patients and stuff like that, and I think that's awesome.
Thank you. I've loved the time that we spent, getting coffee or doing crafts or just talking about life, and that matters. It matters a lot. Your story came up over and over and over again. So many of our students in our class said, she was the most amazing person. She brightened everyone's day, and she's the reason why I want to do medicine and why I want to do medicine better.
Wow.